Hi, everybody. This is a podcast where real medical professionals discuss fake medical emergencies. That means that unless you didn't let the Wookiee win, this podcast is not medical advice. If you need medical advice or medical care, please contact your doctor.
Hi, everybody. I'm Jackson Vane.
I'm Johnny Kolosinski. You might remember me from such podcasts as The Captain's Chair Expert, where I talk to Starfleet's best and brightest about things I know nothing about.
No.
This is Hi, Everybody, a bad medicine podcast. Every week we talk about what Hollywood gets right and wrong about medicine and how the body works. This is our special holiday episode being recorded a couple days before Christmas.
Yep.
You should be getting it Christmas Eve. You can find this podcast online at Hi, Everybody MD, or on all of our social media channels, which are basically Hi Everybody MD everywhere that matters.
Are you talking about HiEverybodyMD.com?
HiEverybody.MD.com, Hi Everybody MD Libsyn.
All the Hi Everybody MDs?
Yeah.
And then you can also call us at 530-DOCTORB. I think this week the B will stand for bone marrow.
The B can stand for bone marrow or boxes of presents.
Sure.
This is our holiday episode where we are going to be talking about a holiday episode of House.
Yep. I was trying to find a good Christmas-themed medical episode to watch this week, and I think a good one would be the Season 2 episode called Deception. Mm-hmm. And it all starts like where everyone should spend Christmas, which is at an OTB,
right,
which is an off-track betting site.
Yeah, it's a gambling parlor for horses.
Yeah, it's where you would go if you lived in, I don't know, like let's say Ohio, and you wanted to bet on ponies in California.
Right.
That's how you would do it. But House goes there and then meets this nice lady there who gave him some betting advice, but he didn't want to take it. And then she promptly had a seizure afterward.
Right. So my first question on this, House was at the bar. He's a doctor.
Not a bar.
Not a bar.
Yep.
At the betting parlor.
Yep.
He's a doctor. Mm-hmm. He sees somebody having a seizure. Mm-hmm. He wants nothing to do with it.
I mean, I will not lie. There are times when I will see stuff and I go, I really don't want anything to do with it. Like when I'm on a plane and someone asks for a doctor, I really hope someone else raises their hands first and not me. But him, he knows he's probably the only doctor in there, and he willingly ignored the lady having a seizure until he noticed like a weird bruise on her.
Until he got interested and then continued to ignore her, but said, send her to this doctor.
Correct.
Who happens to be him.
Yeah, and I think it was funny because that lady started having a seizure, and the guy immediately jumps on her abdomen, like straddles her, and then tries to give her CPR.
Right, gives her CPR.
Really bad CPR.
Yeah,
but still.
which is good medicine in that people think they know how to do CPR, and they really don't.
And here's the thing, that's a really common thing that I will see, is that we had one patient, I remembered, this kid had a febrile seizure, which just, the temperature went up too quickly, and the kid's brain got all confused. And then the kid had a seizure, and the paramedics started doing CPR on the kid, even though the baby is crying, and was still doing CPR on this baby.
Wow.
Yeah, and you can't really be dead and need CPR if you're crying.
Because if you need CPR, it's because your heart has stopped beating.
Correct. Yeah. So the fact that they're crying means there's still circulation. But they continue to do it all the way into like the trauma room. Mm-hmm. Like, you gotta stop. Like, this is not, the baby's not seizing anymore, the baby's crying, we're good, but they would still do CPR. And then it kind of brought up to the next point where the guy goes, well, what should we hold the person's tongue while they're having a seizure? And that is the best way to get your fingers bitten off, because they are clenched down. So basically what a seizure is they're flexing, relaxing at a repeatedly. So if you can imagine that with your jaw and you're clenched, if you put your finger in there trying to hold their tongue, A, your fingers are going to get bitten off, or B, the person's tongue's going to get bitten.
Right, and it's not because they have no control over it. Yeah. It is much stronger than you would bite down yourself.
Correct. And it's real. And I think the reasoning is people go, we need to hold the tongue because they're going to swallow their tongue. That is impossible. The tongue might obstruct, but you can't really swallow from the tip of the tongue going all the way back and to the point where you choke.
Right. Everyone, if you want to take a moment to do that now if you're not driving.
Like, I mean, think about it. Like, try to put your tongue to the roof of your mouth and then try to make that go further back. It's really, really hard, especially if you're tongue-tied too. Then it's just anchored down even more. So the whole myth of holding your tongue so that you don't swallow it it's pretty debunked right now.
So all sorts of bad medicine happening there.
But it wasn't House's fault. It was just the
well, it
bystanders.
was House's fault because he didn't say, that's a great way to lose a thumb.
He did kind of say, like, if you want your finger bitten off, then hold her tongue.
Okay.
But it's a very, like, this kind of addressed a lot of bystander medicine that people aren't, like, aware of or what to do in a case with a seizure, because it's scary. It's like you can't tell someone to stop. You can't hold them and make them stop. They just go.
Right.
And you can't have any control over it. So really the safest thing to do is just make sure they're still breathing, and that's, like, the most important thing you can do, at least when you're outside of the hospital.
So they got her to the hospital, and first thing I noticed, this is the first time I've watched House since we started doing this podcast, and probably since we started hanging out. They were throwing around abbreviations left and right.
Yeah.
Everything was, it's Cushing, so let's do an SLE and a DIC and an LP.
So they were saying the differential diagnosis was either Cushing's or SLE. SLE means systemic lupus erythro. I can never say the word correctly, but it's lupus, which is the common joke of House, right? Everything is lupus. They said the patient might have alcohol withdrawal causing them to have DIC, which is a type of coagulopathy, so disseminated intravascular coagulopathy. I'm going to sound really stupid.
I just called both of those tests, so you sound a lot smarter than me.
So DIC is an illness which happens where your blood just starts clotting or having difficulty clotting, and you're bleeding, and you're having widespread bruising and whatnot. So that actually is an end stage kind of situation where you will die with that. They tossed out ACTH, which is a type of hormone, and then they tossed out the word LP, which is a lumbar puncture, and then an MRI.
Right.
I mean, you should know what that is.
That one I know.
But they were blaming a lot of that stuff, where they said, oh, this patient was withdrawing from alcohol, so that's why she got the bruising, because she has DIC. And that can cause weird clotting and bleeding at the same time. So they wanted to use heparin, which doesn't sound right, because if she was going through withdrawals, she would continue to have seizures, and then she would have the shakes too, right? And there was, at no point did we see this patient have the shakes. So one less thing to worry about, because she was sitting there pretty coherent and kind of talking correctly. They said maybe it's trauma. And I think if I saw a patient like that with seizures and then bruising on her body, that's the first thing I would think about as an ER doctor kind of person.
Was that the bruising was trauma from the seizures, or that the seizures were caused by, like, a head trauma?
Like a head trauma. Like a jealous boyfriend that punched her a bunch of times and then hit her in the head, and then she dropped and had a seizure. So that would have been my first call. But, I work in the emergency department. I think everything is trauma, and I don't believe everybody when they say stuff. Kind of like House. Yeah. But then the crazy part is they asked for a lumbar puncture, which, if you have never seen one before, it's basically just putting a needle in someone's back to collect
spinal fluid.
To collect spinal fluid. But you don't want to do it in someone with low blood cell or platelet count. And that's what they mentioned, that the patient had a platelet count of 89, which is way below the number that I would feel comfortable putting a needle in someone's back.
Why is that?
Because if you put a needle in someone's back and they can't clot, because that's what platelets do,
okay.
Right? You're essentially bleeding into that space, and it's not going to stop. So it can actually either fill up your spinal canal, fill up on the back, cause a hematoma. You might nick a vessel somewhere that you don't want to nick, and that's really a big kind of, I guess, complication of doing a lumbar puncture. Is you're doing it blind. You're doing a lot of it by feel. So you can't really see those blood vessels. So you're trying to guide the needle in between your vertebrae, and trying to put it straight through there without hitting anything else. You're not going to hit nerves because you're going way below, though House's entry was very high.
But that he was doing that intentionally to be a bad doctor.
I don't know if he was or not. I think he was being a little bit of a dick.
In this episode, Foreman, one of his subordinates gets put in charge for 3 weeks.
Yeah,
because House screwed up.
Yeah, but putting the needle in high is really dangerous, because that's actually how you get spinal damage. I remembered in residency, I was supervising an intern, and I asked him, like, have you done a lumbar puncture before? They're like, yeah, I know how to do it. It's super easy. Went right in the middle of the spine, like up near where your heart and your lungs are. And the minute he put it through the skin, I just smacked his hand and said, you're done. Get out. Like, don't pretend you know how to do something that you don't know how to do, because you can actually kill the patient. So, or not kill, but at least seriously maim. And I actually had to kick that resident out of the room for a while.
Going back to us talking about the resident with the "it's my first day" intern.
Yeah.
doing a code.
This was like towards the end of the first year, so they should have known how to do a lot of this stuff, and clearly did not. So that was really scary. But he poked her like 8 times too. If you want to go back to what House did, I stopped after like 3 or 4.
You basically say that I'm not going to get anything from this one.
Correct. So yeah, and then as they poke her, her heart or her blood pressure goes up. She goes into a hypertensive crisis.
Hypertensive crisis meaning super high blood pressure?
Very high blood pressure.
Okay.
And the concern with that is, let's say you had so much pressure in the system, and it's a closed system, something has to give, right? So the
Like
biggest
a balloon, and then something bad happens.
Correct. And then that's the big concern is you might burst a vessel. Where you burst that vessel is a big concern because it could be in your brain, it could be in your like the rest of your body. Who knows where it's going to burst? But the biggest concern is that you're going to stroke out, and that's why they stopped. And I don't know, spoiler alert, if she gave herself medicine to cause that, but they all hang their hat on Cushing still.
Right.
Yeah.
Well, they said that she did give her medicines to cause the Cushing's-like symptoms.
Yes, I don't remember hearing which medicine it was.
Wasn't that the ACTH? ATCH?
Or ACTH?
Yeah.
Yeah, but we never knew where that came from. You actually have to inject that.
Yeah, well, that she injected it into her pancreas, and that's why there was the scarring.
Oh, yeah. That's right. Because that explains the weird CT that they got. Which I've never seen a CT scan like that before.
So explain so what was so weird about it?
There were projections of her organs onto her abdomen. But it was like...
Oh, I must have been taking notes.
I don't know if you saw that,
but
that. Like, so she went through the thing, and they did cross-sectional images on her like abdomen, and it's in 2 different axes. So she's lying horizontal.
So while they were getting her CT scan, they were projecting her CT scan onto her.
Correct.
That's crazy.
That makes no sense.
That's amazing science.
I wrote down weirdest CT scan ever. What the hell is going on? And then it said she had a mass on her pancreas, and the patient was very nonplussed about it. And
yes.
I should have known that was a clue to the rest of the episode. She just didn't care. And then they did the biopsy on her with an ultrasound-guided biopsy.
But they didn't have
the probe on her belly.
Right.
At all. There was just an empty belly. And then they took the biggest pole. It looked like a lance. And just jammed in straight down. The whole point of an ultrasound-guided biopsy is to actually know where you're going. And they're like, good enough.
Yeah.
Bam!
This ultrasound has helped us find her stomach.
Correct.
Her pancreas is there somewhere. Let's get stabby.
Yeah, and they really did. And they stabbed there, and then I didn't even see how they tried to retrieve it. They just straight up stabbed it, and then there's no blood, nothing like that. And they cut to the next scene of him being in clinic.
Yeah. I do want to talk about that scene in the clinic, because it seems like something you might encounter.
Yeah, you can set that one up.
So there was a probably teenage girl or college age woman, in there for a gynecological exam.
Correct.
And her boyfriend doesn't like rubbers, so she's been using the jelly, which presumably a birth control jelly, except for it was Smucker's.
It was, and that was the worst scene I saw in that episode, considering the rest of it. It was just strawberry jam that she used as contraceptive jelly. And I wish that wasn't such a weird comment, because there are very many stories like that in my career. But good Lord, that is horrendous. Yeah, so I feel like he runs into the dumbest clinic patients on earth.
Would that be something that you might actually encounter?
Oh, yeah.
Second question. Do teenagers and college students still use the term rubbers? Because I haven't heard that since,
No. I don't think I've
sex ed videos that were 10 years old when I was in sex ed.
Even when I ask patients if they use any contraceptions, they never say the word rubbers. They'll just straight up use the word condoms because it's not a taboo word anymore. But this clearly was an episode written by some 50 or 60-year-old man who didn't know what they were doing. Because the follow-up scene, or the follow-up part to that episode, was the whiff test.
Yes. So House determined that this was a vaginosis.
Correct. Bacterial vaginosis.
A bacterial vaginosis, and he knew it by smelling.
Yep.
Which, reasonable?
Okay, so the true way you do the whiff test, sometimes you do get the fishy smell, but really you add potassium hydroxide into it, so KOH, and then you actually diagnose it by putting your nose to the test tube and waving your finger to whiff at it. And
Okay.
if it smells fishy, you made your diagnosis. But most of the time, if they're complaining of symptoms, they're complaining of odor, and they're negative on like the other tests like GC, chlamydia, and all that stuff, you're pretty much going to treat them as if they had BV. So BV is bacterial vaginosis.
But what you wouldn't do is invite your boss into the room and then wave a Q-tip under his nose saying, "Here, smell this."
No, that's pretty frowned upon.
Yeah.
I mean, I encounter what's the best way to say it? A grand bouquet of numerous smells at work.
Yeah, this is largely a bad smell podcast.
Yes. And I would definitely not tell my friends who I work with to come in with me, to smell what's going on.
Or your enemies.
Or my enemies. But most of the time, if I know I'm going to be in a situation where something's going to smell bad, I usually prepare with a mask layered with a bunch of toothpaste and then another mask on top because I don't want to smell that. Kind of like how we were talking about previous episodes about certain smells. I forgot what...
C.
C.
diff.
diff. Yeah. Horrible smell. If I knew I was walking in rooms with that situation, I'd have a mask on right away. Like, there's certain smells you just don't want to run into, and that's one of those smells that makes me really happy I'm not an OB-GYN.
That was our moment of levity in
Yeah.
this episode.
Yeah. God, it was terrible.
Before they start discussing that this patient might have Munchausen's.
Yeah.
Munchausen is something that has been on Netflix a lot recently.
Well, that's different. So there's
That's Munchausen by proxy.
Correct. This is Munchausen.
Right.
Where basically it's doing self-harm to get secondary gain. Or making it look like a medical problem to get secondary gain.
So to get attention from doctors
Correct.
or
from anyone. And usually it's... The nice way that people try to put it into charts now is like overutilization of medical services to the point of harm. Because if you use that, it doesn't sound as bad as saying you have Munchausen.
Right.
A lot of medicine's trying to move away from eponyms to not associate, making you memorize sicknesses associated with one person. Instead, actually making a diagnosis where it is what it is. So an overutilization of healthcare services is actually a good way to kind of write in your note as a wink, wink, nod, nod, if anyone can ever get access to your notes in a different health system. So, I mean, people were saying she injected herself with the medicine. She was there 4 visits in a month. She had Post-it notes all over her house about various doctor visits. And House makes a weird statement saying a person with Munchausen will drink battery acid to make themselves feel bad. And it's not necessarily true because battery acid is very obvious. Whereas savvier Munchausen people will figure out other ways to make them ill or present with symptoms to make it look like a real thing and confuse doctors.
generally, would you consider how savvy are Munchausen? Or, I'm sorry, the people with this condition
Munchausen?
or Munchausen by proxy?
Depends how much research they do.
Yeah.
So, like, some people will do a lot of research or over-research and say, like, my patient has, or my kid, if you want to do Munchausen by proxy, like, has this sickness. Mm-hmm. And it could be, or they get seizures all the time. And it could be as simple as them getting so much salt through whatever means they can to induce that. And that was actually a case with a mommy blogger who said her kid was super, super sick, had a G-tube put in, and then every day she would flush a bunch of salt into the G-tube and actually make that kid have hypernatremic seizures and stuff like that. Wow. Or inject them with insulin to the point where they have very low glucose and then pass out and then have seizures too. One case I had where we were pretty sure with Munchausen was a mom who would say her kid's G-tube would clog up and break on a monthly basis. And the reason why we knew it was BS was one night we saw her jamming chicken tenders down the G-tube to try to feed him, quote unquote. You can't see me doing the finger quotes, but that's what she did. And she would do that constantly or just rip it out while the balloon was still inflated and cause issues like that. And the only reason where we caught her was we had a sitter outside the room and actually saw her doing all that stuff. But she wasn't savvy enough to realize that that was a guy who was spying for us. So Munchausen is just really one of those very hard diagnoses, but you never want to hang your hat on it. You want to diagnose it's a diagnosis of exclusion. Mm-hmm. You got to make sure you're treating all the bad stuff first and not just going into a room and saying, you're crazy, you need a psychiatric consult, get out of my hospital.
Which is what Foreman basically decided he wanted to do.
Yeah, but Cameron actually walked in, and she actually said that to them was, you're crazy, you don't need to be here, you're faking everything. And then leaves a bottle of rifampin on the table for her.
Mm-hmm. And what is rifampin?
It's an antibiotic. It's one of the principal antibiotics used to treat tuberculosis.
And the reason that she left it was
it makes your pee orange.
Right. And apparently, at least on House, your tears.
Yes. I remember that was a prank we did in med school.
I had a story of someone I know who this was decades ago, who was a pharmacist, who did the same thing with something that made your pee turn blue because somebody kept stealing people's drinks.
So we also did that too. It was it's called methylene blue.
Yep.
It makes your pee very blue, and it's hilarious. So it's actually a really fun prank. And methylene blue doesn't really cause any badness to you.
Except for blueness.
Except for blue
You
pee.
blew yourself?
Yes. And, oh, God. But that's the fun one to do, because it's relatively harmless, and it'll freak everybody out. So,
I do have a
yeah
question of something that happens a lot on House.
Okay.
And that is, your doctors go to your house, go to your home to check out your living situation and see if they can figure out what's wrong with you based on the stuff under your sink.
Correct.
And in reality,
no.
Ever.
No. I think the only time I've actually had anyone go to someone's house was to look for a DNR.
I do not resuscitate order.
Correct. Because, especially for older people, you don't want to save them if it means it's going to cause them harm, or they don't want to be alive. So EMS will actually go to their house while they're, a patient's down or whatnot. While they're running CPR, they might have another group look for a DNR form. And most of the time we tell them, hey, you should put a DNR form attached to your fridge. And actually, that's what most older people with DNR forms do, is they'll put it on their fridge. So that if something, God forbid, happens, they can find that and actually end it there.
Because you don't want it in a drawer somewhere that can't be found until 3 weeks later when somebody's going to get your underwear.
Later, House accepts that the patient has aplastic anemia and Munchausen, but I would say if a patient did have aplastic anemia, they would be pale as a ghost.
Right, which we basically saw start happening shortly after aplastic anemia started being discussed.
Correct.
So it wouldn't, if they were symptomatic at all, you'd see the paleness.
Yeah, their lips would be pale.
So anemia is generally low iron in your blood, right?
It's low hemoglobin.
Low hemoglobin in your blood.
Yeah.
What is aplastic anemia versus other types?
So aplastic anemia basically means your bone marrow is not making any viable blood cells.
Okay.
So red blood cells, white blood cells, platelets, none of them are good. And you're basically an immunocompromised person. You have no immune system. You're not going to function. You can't fight off infections or anything like that. So if that was the case, and a spoiler alert towards the end of the episode, if this is what was going on, she should have been really sick and sickly ill, dying ill. And she wasn't. And then they kind of boot her out.
They boot her out, but before that, House gets to run some tests on any extra blood they have.
And the blood...
Number one.
Yeah.
How often, if I'm in the hospital for 16 hours...
Okay.
How much extra blood of mine will there be lying around loose outside of my body?
So here's the thing. If you came into the ER and I just go, can you get me a rainbow? Which was a common term that we would say at one of my hospitals I used to work at. They would just get every tube of, every top of blood collecting tube has a different color.
Right. Is that based on what you're testing it for?
Correct. So I just told them, get me a rainbow on this patient and save some just in case. So
they would do that.
They would if you asked for it.
Right.
Yeah. So there's always a chance you can have an extra tube or two lying around. But the preservative in each tube is different. So you can't run all the tests on a random tube, because the preservative that keeps the blood from coagulating or breaking down or whatever test you're looking for, affecting that blood breakdown from causing false values in that test would mess everything up. But the tube that House used was essentially a lumbar puncture tube with maybe a cc of blood, quote unquote blood. If that was the tube that they used, that blood should have been clotted by at that point.
Yeah, because there was nothing in the tube except for the blood.
Yep.
Which was bright red.
bright red, watery.
Yeah.
Yeah. So
it was unjelloed jello.
Correct. And so they run a bunch of blood tests, and they said, oh, her EBV titers were positive. And the problem with checking EBV titers, there's multiple values associated with it that can tell you if it's an old infection or a new infection.
Well, they found out that it wasn't even her blood that they ran. Because of the sickle cell.
Though, if she was taking certain...
He did specifically say...
What sickle cell?
That it was sickle cell, and House said that it wasn't hers.
So the other thing that they were trying to say was it was because it was fetal hemoglobin, and only sickle cell patients make fetal hemoglobin, which is not true, because if you have aplastic anemia, you might make weird fetal hemoglobin.
Okay.
So that's the weirder part there. But then, as the episode progresses, they kick her out, and Cuddy says, I signed her discharge papers, she's out. I've never heard anyone signing discharge papers, and it was funny because they were mentioning how no one had signed any of their discharge summaries for a year. And that stuff you need to finish within, I think a week, or 72 hours to a week after discharge. Because it's really hard to recap an entire patient's stay a year later.
Right.
I hate discharge summaries. That's why I'm an ER doctor. I never have to do discharge summaries ever. Because it's like writing a novel. It's like system by system, what happened in each system, how you treated, what the follow-up plan is, so that the next time they get admitted, someone can read their discharge summary and see what happened during the
Jackson
hospital
can read their discharge summary next time they're there.
Yes. And this is a patient that should have a very extensive discharge summary with the mention of the word Munchausen in it, which is essentially what this patient had. But before we got to that final diagnosis, House had to play a little bit more with her.
Right. So what he did was he injected her with insulin to give her a seizure.
Yep.
And then
colchicine
to give her the symptoms of the aplastic anemia that he believed she had.
Correct.
I'm guessing that's frowned upon.
A little bit, yeah. Colchicine is used for gout. And if you overdose someone, that actually does wipe out their bone marrow. So you basically tried to kill her two ways.
First with the seizure.
With the seizure, by dropping her glucose super low. And then B, by knocking out her entire immune system again. And that kind of messes everything up right there. Now everyone's in agreement. Oh yeah, she clearly has aplastic anemia because she's bruising. She has immunosuppression. So they try to irradiate her.
Yeah, they irradiate her by sticking her in a room that's 4 inches of lead by 4 inches of lead, and give her a fantasy breastplate with a belly button.
Yeah, I'm pretty sure they stole that from one of the old, a Valkyrie movie almost.
Yeah,
because it was just a breastplate with full on shapely breastplate with boobs and
a belly button.
And a belly button. And I've never seen anything like that. I know I have radiation oncology friends, and I'm pretty sure they've not done anything like that at all. There are times, though, when you do need to do very guided, directed radiation. They will wear a mask, but the mask itself is kind of shaped to your face, but nothing to that extent where it is essentially a boob plate. Or a breastplate, I guess. Technical terms, obviously. But while she's in the room, House is being super creepy and lying in her bed and sniffing her.
He smelled sweetness on the pillow, and so he sniffed her clothes and bra, and recognized that this was a bacterial infection because it smelled sweet.
Yeah, they said that she had Clostridium perfringens, and that was one that I remembered learning in microbiology as a very disgusting one. And they usually don't live because they are so sick, and it causes something called gas gangrene. So you guys know
gas gangrene is exactly like it sounds.
Yeah, so you know what gangrene is,
right? Gangrene is your body's rotting while you're alive, basically.
Correct. But it also causes bubbles on top of your skin. But also in between your muscle layers, too. So actually, when you feel their skin, it'll feel very crackly, almost like Rice Krispies. And then it's described as a putridly sweet smell, which is kind of why I think House described it as a grapey smell. I've never smelled gas gangrene before. I smelled regular gangrene, and it's horrible. Oh, yeah. Someone made a really good point that this was basically It was a callback to
It was a callback to the jelly.
The strawberry jelly.
Yeah.
Now you have grapey, putrid smell.
So this episode is sponsored by Smuckers.
Correct. Oh, Smuckers is such a bad name for jam if you think about it. Like, who wants to eat something called Smuckers? Like, if you're trying to think of something, like, really tasty and whatnot, Smuckers is not the word. And now with the word gas gangrene associated with Smuckers, that just is even worse. I know they're never going to be a sponsor. It's fine. But it is not one where patients look well. Mm-hmm. They look really sick. So
it sounds like it'd also be incredibly painful, even more painful than...
At that point, if you're already showing signs of gas gangrene, which she was actually showing with the bruising, she should be very septic and dying at this point. And they attributed it to her getting
a course of antibiotics as part of the earlier tests.
Yeah, which doesn't fix this right away. Like, they said, let's give her Augmentin. The real treatment is just penicillin. Augmentin is a type of penicillin, but you definitely don't want to just start with oral antibiotics for someone like this. You want to start with very broad antibiotics, at least at first, or a little something IV first. You know. The other things you need to do is you need to cut out all that bad tissue. You know, because that's all necrotic, gangrenous tissue, right? You got to get all of that out. And then there are studies where you can do hyperbaric oxygen to actually help facilitate healing. But really, you got to get rid of all that bad tissue. And of course, because this is a Christmas episode, it ends on a high note.
Yeah.
She goes to another doctor.
She goes to another doctor while the Charlie Brown music is playing.
Yes. And looks for more help.
Yes.
Even though she needs a different kind of help than the help that she's searching for.
Right. She goes for more physical treatment as opposed to psychological treatment.
Yeah, and she definitely needs a lot more psychological treatment. It was just... This is the frustrating part when you deal with those Munchausen patients is just... especially for ER physicians, you're starting a lot of times from square one. Unless this is a patient that's been to the emergency department a lot, you're pretty much just helpless, and you're going to treat them as if it's the world. And most of the times, even if we did have the diagnosis of Munchausen, we would still be working them up from scratch, trying to figure out what's going on, because this might be the time where it actually is a real thing. Mm-hmm. And you can never assume 100% that they're faking, but you can definitely assume 75% that they're faking, but there's still that 25% that it could still be real. Mm-hmm. And that's the scariest part about some of these patients.
There was just one little toss out as they were doing the diagnostic stuff that stuck out for me.
Okay.
And that was when House wanted to do venous sampling.
Oh, God.
But that was deemed to be too dangerous.
Yeah.
I'm not a doctor.
Yeah.
But to me, venous sampling would just mean I'm getting a sample from a vein.
Correct.
That doesn't sound dangerous.
No.
Okay.
No, it doesn't. I mean, if they said arterial sampling, that would be a little more painful. Mainly because that vessel's a lot thicker, so you actually have to... The needle going in actually hurts a lot more. Venous sampling, it shouldn't hurt that much, and I don't know why everyone was
just a regular blood draw.
Yeah, and they did it all episode already, too. What's-his-face was calling out every single test he can think of, Foreman. Every single test he can think of, and half of those tests he was calling out were probably just venous testing.
Maybe she just ran out of veins.
So that is actually a really big problem. It's a real problem with IV drug users. Mm-hmm. We run out of veins that we can use.
Because you generally only want to use the big ones that are on your arms or your leg.
No, but when they get desperate, any vein's a good vein. So scalp veins, they'll find a vein in their scalp. Toes.
Oh, wow.
Feet. The tiniest veins, they'll try to go for it. And the problem is the more times you use it, it's going to scar. Mm-hmm. And then when they get to the tiny ones and we're out, the only way left is a bone drill.
Right.
You don't want to use that unless you really, really have to. And the problem with that, too, is the places where we would go for a bone drill, if they inject or do skin popping over that, we can't use it. So running out of veins is actually a legitimate problem. And it's a scary problem. But yeah.
There goes that joke.
Why?
Sorry, guys.
That
was the joke. The running out of veins.
I mean, it's true. You can actually run out of veins. It's like legitimately the nightmare of an ER.
Yeah.
Yep. But yeah.
Well, with that,
are you going to ask the horrible question?
I've got a horrible question for you, and that is, the Human Centipede bills itself as 100% medically accurate.
Sure.
if that's true, how medically accurate is the episode of House called Deception?
You know it's pretty on par, right? Like, just kind of watching, you'd have to agree, too. It's pretty on par with Human Centipede medical. Or would you say it's less?
I would say it's less because of the fact that it was throwing out so much terminology that didn't seem to fit.
Okay, so...
Like the Venus.
That stuff, yes. The alphabet soup stuff, I think, fit pretty well. Because they actually were using legitimate terms and whatnot. So, a lot of it kind of fit. The CT scan, obviously, no. But that's just technical, like, special effects kind of deal.
It's kind of like with the angles of giving an injection at a right angle.
Correct.
It's just something that's going to happen.
I mean, I'd say it's probably 95%. It's close. Like, I would say, actually, no. I'd say it's 100%. Only in terms of Human Centipede. Because Human Centipede, we all know, is not 100% medically accurate. So
then why was it on the posters?
Touche. I mean, what?
Thank you.
Going mouth to butt?
Yeah.
I mean, if you haven't heard that episode yet, you really got to hear that one.
That's your Christmas Day episode, folks.
That is actually, gather the kids around.
Get the family together.
Watch the movie first as homework, and then listen to our episode.
Yeah, around a roaring fire.
Yes.
Hopefully with an empty stomach.
No, it's better with a full stomach. It makes it just more fun.
No eggnog.
No eggnog, yes. But it makes it more fun.
So you'd say that this was pretty spot on by our highly scientific scale.
Correct, yeah. I mean, there's very few things. There's a few things I would probably change. But the frustration of Cameron talking to a Munchausen patient is basically what all of us want to say, but we can't say it. Because I get it. It's the most frustrating thing to deal with someone who you know is faking, but you can't tell them into their face. So that part hits home, especially for someone who works in situations where we deal with patients like that all the time. I would say the one thing that you would probably need to change to make it look more gross is just the cyprifrinogens kind of manifestation, because that's actually one that would make it look a lot more fun. Also, Clostridium perfringens is also related to Clostridium difficile. Which is
so we're doing a theme.
Yes, it's the Clostridium month, but it's the same as C. diff. It's in the same family as C. diff. So, but you can actually make it a lot more realistic just by making it grosser.
What about? And this is a question I often have with House specifically. The politics. The Cuddy, the director, because of mistakes that were made previously, promoted House's subordinate above him for a month to teach him a lesson.
Yeah, I as a lowly doctor on the totem pole, I don't know that as well. I hear about it, but I don't know much about it. Okay. So I can't really help you on that part.
Okay.
That's my political answer, too.
But if it happens, you don't hear about it, and that's your story, and you're sticking to it?
I mean, it's true, though. I really don't know what happens. Like, I just work and stuff like that, and the internal politics is one of those things that I try to keep my head out of, because I am just there to see patients and make sure they're better. So that's my big...
So, question number 2. If you were going to rewrite this episode to be more medically accurate while keeping the stakes high, are there changes you would make?
Make C. diff look... Or, not C. diff. C. perfringens look worse. Because that would make the stakes different. Because essentially what House did by injecting her with colchicine to suppress her bone marrow was a death sentence at that point. So that stakes... If they
it would have been a death sentence even before they started to radiate her.
Correct. Because her bone marrow was already down, right? She had like pretty much nothing left. That was actually a death sentence for her. Like, she would have been overwhelmingly septic at that point, and they probably should have given her antibiotics before they did the irradiation too,
just to be on the safe side.
Yeah, especially if they had any other findings that would make them think that she has an infection. So that was a big concern right there too. Also, gas gangrene. If you had all those like bubbles already on your body, her clothes would have been just soaked through with goo.
Ew, gross.
Like purple grapey goo. And I'm surprised.
So grape Smuckers, not strawberry Smuckers.
No. Yeah. Man, it is a jammy episode.
Yeah, it's jam-packed with facts, guys.
God, terrible. So bad. But yeah. I think that's the big things that would change the stakes with. The Munchausen part, that all's like a pretty good way to represent it without offending the Munchausen population, I guess. But yeah, I thought it was fine.
And maybe not have the home visit, because
that's breaking and entering.
It's breaking and entering.
Correct.
And added nothing except for us seeing that House doesn't care about his life, so he doesn't wear a helmet.
Correct. Yep. That is it.
Cool.
But yeah, I think it's a good. I mean, it didn't feel like a Christmas episode until the end, and
when we saw Christmas trees.
Yes, correct. It was. I mean, they always have good Christmas episodes. This one was just the one that kind of hit home a little more.
Yeah, a little less Christmassy, but a good episode.
It was a good episode.
Yeah.
I agree. Yep.
All right. Well, we will try to be back next week for you, folks. We've got holidays going on. So we'll let you know if anything changes. If you're listening to this before Christmas and you celebrate Christmas, Merry Christmas or Happy Hanukkah or
whatever ones that you celebrate.
Whatever celebratory mood you are in as you listen to this episode.
Yep.
All right. Thanks, folks.
Thank you. Bye.